I'm LAURI Romanzi. I'm a gynecologist from the US. I've worked with the team here at Panzi many times to help women with fistula and women who continue to have problems after many fistula surgeries, including problems with the bladder, problems with incontinence, problems with infertility, depression, anxiety, problems walking. Many problems are associated with the causes of fistula. And I think many times these women who have complicated cases, they feel hopeless. And it's a torture to understand their pain. It's a torture to address the inequity. It comes from inequity. Fistula was everywhere in the world over 100 years ago. It was eradicated in North America and Western Europe, and still today, it is a constant threat for women living in almost all of Africa. Unless they're wealthy and educated, they have this as a constant threat every time they're pregnant. It's not fair. So we join with these women because we understand the frustration, and in my position, I can see the inequity. I trained in the United States, but I've worked here in Panzi and many other places in Africa and Asia, and it's completely unacceptable that fistula persists today. Politically, it's unacceptable. Financially, it's unacceptable. Socially, it's unacceptable. And when it comes to health, there's no health associated with fistula. It's only problems. Even if you close it, very often the women continue to have problems and their lives are never restored. And that's simply the truth. When we have a simple fistula and we can fix it easily and the woman's life is fully restored, it's a gift from God, really. Because all too commonly, women with fistula have problems for the rest of their lives, and they should never have had the fistula in the first place. Now, my role is Director of the Fistula Care Plus project, a USAID-funded project that is managed by Engender Health in New York. I'm very proud to have this position because it allows me to empower women in a different way, to look at where is the money going, how is it being spent, who's being mobilized, where are the gaps in food, gaps in supplies, gaps in access to remote areas. And here in Congo, especially in the remote areas, there is such a huge unmet burden of disease related to fistula and poor or complete lack of access to maternal health services. We must address this, and where we cannot fix it, we can always have our voice. So if we cannot fix it now, we can advocate. We can advocate internationally, nationally, regionally, locally, anything that makes sense that helps to reduce this horrible problem is necessary, and we have to do it right now to the best of our ability. When you think about all the factors that contribute to fistula in Congo, you can't even stop. It's just endless. You have challenges because of absolute lack. When you think about the fistula problem specific to Congo, you have to think about the UN Secretary General's call to action in 2016. The UN stated clearly that the time to eradicate fistula is now, and that we have a mandate globally to eradicate fistula within a generation. When you think about the fact that fistula was eradicated in high-income countries over 100 years ago, this argument, there is no debate. We must do it. And how do we do it? You have to start with traditions. You have young girls, 8 and 9, being married, having a baby, even before they have their first period. And their lives are caught in a cycle. So even if those small bodies birth the first baby without a fistula, she is trapped in a cycle where she has no access to care, no education, and most importantly, she is not empowered. With the Sustainable Development Goals, we have a mandate to empower women and girls. If we fail to empower women and girls, we will fail women, we will fail the planet in terms of the Sustainable Development Goals, and very crucially specific to fistula, fistula will simply persist. In fact, it might get worse. So we need to evaluate these traditions. We need to give access across sectors. We need good transport. We need good education, and girls have to have access to this. Women have to have access to education at the higher levels, economic empowerment, participation in government, Women have to be at the policy table because women are the best at representing the challenges that girls and women face. Nobody can do it better. We can do it for ourselves. It's been shown in other parts of the world, and the same is true here in Congo. Congo has extra challenges because Congo, across all sectors, has many barriers to adequate implementation of everything. Political rights, education, transportation, food security, sanitation, clean water. Where do you begin? And in an environment where everybody is hungry, it is difficult to say, now we're going to eradicate fistula. In an environment where girls don't get education and they're married by the time they're 10, it is difficult to say, we're going to eradicate fistula. And in a system that has very poor infrastructure for health and no unifying government activity that is reliable, it is very difficult to say we are going to build strong maternal health systems. We're going to build safe surgery and anesthesia systems for every community, for girls, for boys, for men, for women. And in that strong healthcare ecosystem, fistula can eradicate itself. But without education, how can a girl know that she has the right to get care? If she's not empowered, how can she have the right to demand what she needs? If she doesn't understand that the hospital is a place that can save her life, she might wait too long. Delay in accessing care is something that we understand very well, not just for fistula, but for all healthcare services, for all reductions in mortality, child mortality, newborn mortality, maternal mortality, life expectancy, all of that. We understand the barriers very well, but without an adequate social contract between the government and the people it serves across all sectors, it's almost impossible to address the problem with success. You can have success in a region, or maybe a town, or maybe a city, or maybe around one hospital that's very strong, but for the country as a whole, it's going to require strategy across sectors and a dedication at every level to the empowerment of women and girls. Women and girls also need access to family planning. There can be no debate about this. And one big challenge to family planning is procurement and supplies. You can talk about family planning all day, but if you don't have the materials to provide the family planning reliably when the woman needs it, when the girl needs it, with the choice that she's selected, then it doesn't succeed. So, until we empower women and girls, and until Congo decides that it's ready, right, to work across sectors, to build the roads, to build the schools, to create the laws, to enforce the laws that will empower girls who will grow up to be strong women who can determine what's best for themselves, for their children, and their families. And we all know that's what women do best, right? We're not going to see an end to fistula in Congo, and this is unacceptable today in 2017. We cannot accept it. It's not correct. And this is what I have to say to these women. These women with complex cases have often had 4, 5, 6 surgeries. Their bodies are destroyed. They have no hope. I've seen it too many times after many surgeries, even if you can somehow restore them by bringing in an expert who has special techniques, they are so damaged psychologically, they never recuperate from that anxiety and depression. They're walking around with a constant post-traumatic stress disorder. And it still hangs over them, it holds them back. It makes it difficult for them to return to their families, even if they're functional again, even if they have good control of their bodies. And so many women with complex fistula surgery, so many women with complex fistula conditions are never really fully restored, and they know it. If you go out into the community after they've had care, they'll tell you. So they need support services. Support services for chronic disability is very difficult in a system like we have here in Congo, where across sectors we have big weaknesses at every level. How do you take care of them? They want to go back. Many of them live in remote areas. That's where their lives are. How are we going to take care of them when they go back and they still have foot drop? How are we going to take care of them when they go home and they need medication to control their bladder? How? You have to have procurement, you have to have supply chains, the roads have to be open, they have to be free of conflict. And you can't do anything, again, without food security and sanitation. So the very basic things, food, clothing, and shelter, have to be met across the population. When I think about fistula in Congo, again, like I said, I can't stop. My worries and concerns go on and on. And when I'm able to come here and work with my colleagues, I simply do what they're doing. They're doing what they can do to the best of their ability with what they have available, but they're always keeping their eyes on the prize. How do we eradicate fistula in Congo? How do we eradicate fistula in Africa? Why is it persisting? It's the ultimate inequity indicator for women and girls, this problem with fistula. It's not supposed to be happening. When I think about Dr. Mukwege, he is one of the biggest heroes in my life. He's a leader, a visionary, he's a skilled surgeon, and I have watched what he has done here at Panzi Hospital. I was here when the women would run to the downspouts to gather water in flat pans every time it rained because there was no water system at the hospital. I watched him procure a CT scan machine with donated funds when he didn't have a building to put it in. I've seen surgery done here with no anesthesia because it was an emergency and they didn't have the supplies or the equipment. And now I'm walking into a hospital that has well-run imaging services, not just for CT scan, but for X-ray, for sonography. They have a full laboratory. I myself would put myself on any operating table in that theater with any of the surgeons here at this hospital. The anesthesia is solid. It's on par with anything I've ever dealt with in the United States. They have outreach services. They've translated many things into local languages. The community trusts them. You can see it. You can see the trust when you walk through this place. The community knows that if they come here, people care. You can pay people to show up anywhere in the world, but you can never ever pay people to care. And everybody here at Panzi cares so much that they made it work when they had nothing, and now that they have strong systems through Dr. Mukwege's leadership, this place is glowing. But that doesn't come from nowhere. Dr. Mukwege is from Bukavu. He grew up here. He saw it when it was in its golden age. He saw it fall apart. He dedicated his life to building this hospital, to supporting this community, and to fighting for the rights of women and girls. He's taken on an international agenda to support women who have suffered the horrific epidemic of gender-based violence and sexual violence. It continues to persist here in North and South Kivu. It's a very difficult place to be a girl or a woman. But when you have people like Dr. Mukwege, you have some hope that things can be corrected. And so I can only support him, and I continue to admire him, and I look to him for ideas and leadership because he's always prepared. He is always prepared to inspire and to lead and to support people who are willing to understand and take up the rights of women and girls everywhere in the world.